I'm Nikia Grayson. I'm a certified nurse midwife and anthropologist in Memphis, Tennessee. Um, my pathway to midwifery, it was actually an interesting pathway. Midwifery is not my first career. I really never saw myself as providing care for people, but like I said, I have a background in anthropology, specifically medical anthropology and public health. And I was working on a project with the March of Dimes. I was actually evaluating the project. Um, and it was a project called Community Voices. And this project was really talking about infant mortality in our community. And it was specifically geared toward Black families who had been experiencing high rates of infant mortality in the community. And I was interviewing families about their experiences with infant loss and interviewing them about their experiences with accessing maternal health. And it was really interesting what they were saying. A lot of them were really surprised at the high rates of infant mortality that the Black community was experiencing, but also they spoke about their own care, and they spoke about care that they just did not feel was adequate, and that it was not respectful care, and it did not treat them with dignity. And so I thought that was very interesting. And then I started interviewing older Black women in the community, and they talked about care with midwives. And they talked about these Black midwives, these grand midwives who they had birthed with, and these midwives who really took care of the whole community. And so I was kind of intrigued by that because we didn't have any midwives in the community. And well, we didn't, I should say we didn't have any Black midwives in the community. So I really just started doing more and more research about midwifery, the history of midwifery, the history of Black midwifery in the South. And I saw this gap and felt this call to fill that gap. So here I am now, 6 years later, as a midwife who provides, sexual and reproductive health care, as well as, prenatal care and birth services in Memphis, Tennessee. I love this work. I love caring for my community. I love the people that I serve. I feel like it's an honor to be a midwife in Memphis. I think that I'm drawn to it because there was this gap in care in our community, and a lot of the people that I interviewed and families that I met talked about just not feeling like they were truly cared for through our healthcare system. There was, the lack of access to culturally and linguistically appropriate care, and we just saw that a lot of families were slipping through the cracks, right? And so to me, being able to be a midwife in my community and care for families has not only been, transformative for me professionally, but it's also been transformative for me personally. And it just gives me a lot of joy. And a lot of the families that we end up caring for, of course, come back to us for care for their other needs, especially around their wellness needs and their family planning needs. But what we also found was that the care was transformative to them professionally. A lot of those families, a lot of the pregnant people that we care for have gone on to be doulas and lactation counselors and nurses and even midwives now. So I feel like we are changing our community and growing our own birth workers and really becoming the answer that we need to address the maternal health crisis that we are seeing in our community. We tell all of our patients that they will know how they should be treated by healthcare professionals when they leave our care. It's really important to us that they are centered in their care. They are experts in their own lives and in their own bodies, and we have tools and resources. And, our goal is to partner with them and really let them lead the way. And I think that by us showing them that they are important and valued, that they just really pick up that mantle, and really it is transformative. And so it's been an honor to really provide care in this way, and to really be a disruptor to the present healthcare system that we have, that really treats people as invisible, or even as just another body. Yeah, I think that we know that there are increased barriers to care for um, people of color. And, this includes limited access to, providers and hospitals. And of course, like I said earlier, lack of access to culturally appropriate care. And what we're seeing is that these challenges, they're more pronounced for those in more rural areas, or those areas that are become like medical deserts, and so in Tennessee, we've seen the closure of many hospitals and clinics and labor and delivery units. And so what's happening is forcing people to have to go out further to seek out care. But also what we're seeing is that they're coming to care later because they don't have immediate access in their communities. And so this is a huge issue, especially when we're talking about the maternal health crisis, because a lot of times people are waiting longer to seek out care, or, really discounting some of the things that they may be experiencing because they have to travel so much further for care. Some people who are accessing care in our communities are traveling up to like 3 hours to come to our clinic so that they can receive care. And that's really unfortunate, and really it shouldn't be that way. I think that the maternal health crisis impacts the Black community in many different ways, right? We're talking about Black youth. We're talking about those who are gender expansive, and those who may be experiencing, social insecurities. But I think that the impact has been the same, really, in a lot of ways, in that they are looking for quality care, and they're looking to be seen and heard and respected in their communities. I think that our LGBTQ patients are looking for, affirming care that's respectful and respect their reproductive health care choices. But I think that all of our families are looking for that. All of our families, whether they are same-sex couples, or just heterosexual couples, I think they're all looking for the same thing. They're looking for they're looking for care that's going to be respectful, care that's going to affirm them. They're looking for care that is culturally congruent, and care with providers who really do understand what's happening in their communities. And I think that's across income levels, it's across, any social factors, honestly. I think that they're all coming to us for the same thing, and that they're all coming to us for the same reasons, because we embody, reproductive justice principles, where we recognize that people should have the right to have families on their own terms, and to be affirmed in that care. So I think that a lot of the patients we see, regardless of their sexual orientation, or regardless of their education level or their background, they're all looking for the same thing from us: to be able to provide care that's comprehensive for our LGBTQ constituents has been very eye-opening for us in terms of what their needs are. But what we're seeing is that not only do they come to us for their hormone therapy, but they're coming back to us for their reproductive healthcare needs, and then coming back to us for their pregnancies and prenatal care and birth services as well. So what we're seeing is that we are providing care for them along their reproductive lifespan and helping them in terms of finding sperm, or helping them in terms of intrauterine insemination, and helping to connect them with the services that they may need that are outside of our care, but connecting them with affirming providers. So it's really important to us that we vet the other providers that we send our patients to, so that we can ensure that they have a really great experience. One of the things that's really interesting, I'll say, about our clinic is that we're not just providers, we are also advocates, and we work to reach out to our legislative constituents, as well as to those who are in power to make decisions around legislation. We invite them in. We want to have conversations with them to let them know what is happening. And so we also, want to talk to them about ways that we can increase access to, an array of services and providers. So, one of the things is really growing the number of midwives in our community and helping to diversify the workforce here, the healthcare workforce here in Memphis, but also, bringing attention to what is happening in terms of those people who have to travel further to access care, but also talking to them about, insurance and lack of insurance for patients, and patients having issues in terms of accessing just equitable care, right? And so we find ourselves advocating with, like I said, with our legislators, as well as really talking to people in our community, really making them aware of what is happening in the community. We have open houses here in our clinic to bring people in to talk to them about different things that are happening in our community as well around maternal health and sexual and reproductive health. Because what we find is that we can educate, the more people that we can educate, the more likely we are to be able to close that gap in those barriers of care. We've seen, some success in our advocacy. I think that we are definitely working to make the community aware, especially success in our advocacy around midwifery. Our local legislators here know who we are. The mayor of our city, he gave us money to fund our midwifery fellowship. We have a Black midwifery fellowship where we train midwives in comprehensive reproductive health care. We train them on gender affirming care. We train them on, community birth. They get to work in our birth center. They get to do wellness care as well. And we also actually train them in abortion care. And so our mayor gave us money to fund 2 fellows this year. And so, we are making an impact in the community. And I think that people are seeing the work that we're doing, especially the outcomes that we're having. We're having amazing outcomes in terms of our patients, and decreasing the preterm birth rate, as well as we're having quite a few successful VBACs. Actually, we have 100% VBAC rate. So that's been really amazing, considering that a lot of people in our community don't have access to providers who will allow them to have a vaginal birth after a cesarean. And so, we've been having a lot of success in terms of what we're seeing and what we're trying to do in the community. Yeah, so with the education that we provide our fellows around gender affirming hormone therapy is really comprehensive. One of the things that's really important to us is that we serve our community and the community needs, and this is definitely one of our community needs. So we also partner with our local LGBTQ resource center, which is called Out Memphis, and they come in and they educate about LGBTQ health as well, and about services that are needed, like mental health services and wellness services, but also gender-affirming hormone therapy. So we partner with them to provide that social understanding of what's happening in the LGBTQ community. And then we do training that is hands-on training for our fellows that is based on the curriculum that we get from University of California, San Francisco. And they are able to see our patients in our regular wellness clinic. So we see probably 10 to 12 patients for hormone therapy a day. And they get that hands-on training. They learn how to interpret lab work. They learn how to provide social support as well as, necessary medical support. And they also learn how to connect them with other resources that they may need, like mental health services or, services around housing or food insecurity or things like that. So we really do try to provide like these wraparound support services for our patients as well. I mean, I think the education of the birth workers is really important, and really the fellowship that we have here. While there are other fellowships, midwifery fellowships in the United States, I think what sets us apart is that didactic piece that we have, which is where we are really working to deconstruct providers and reconstruct them from this social justice perspective, and really infusing reproductive justice principles into the care that we provide. And so I think that that's one of the best things that we can do for our community, because honestly, it's not necessarily the community that is the problem, it really is the provider. I've seen many families that have come to us and have had really bad experiences in the past, and then we really help them to rewrite that birth story. And I remember when I was a student, I met this young lady, and I'll tell you her name, I'll tell you who she is. So when I was a student, I met this young lady, her name is Rhonda, and Rhonda is also a nurse, and she told me about her birth experience. Her baby at that time was maybe 9 months old, and she told me about her birth experience. She's a Black woman, she's a nurse, and as a nurse, she really thought that she would be listened to and cared for differently in her care. And what she found was that she wasn't, and that when she had told her OBGYN that her water had broken, she was dismissed and told that she was probably just urinating on herself. And then she went to the hospital some hours later and told them the same thing, and they sent her home as well. And it wasn't until maybe 2 days later that they realized that her water actually had broken, and her pregnancy actually ended in an emergency C-section. And she talked about how traumatic that was for her, and how she just didn't feel, listened to or respected. And she really felt that her being a nurse, her experience would be different. And so she told me, this is when I was in midwifery school, that if she ever had another baby, that she wanted to have it with me as her midwife. And I was like, okay. And so some years later, maybe about 5 years later, Rhonda got pregnant, and she reached out and said, I'm pregnant and I want to have a home birth, actually. And I was like, okay, let's see what we can do. And so she came in for care, and she told me that the care that she received was the most comprehensive, amazing care that she ever had. And she ended up having a successful home birth after a cesarean. And she really felt like it made her whole and rewrote her birth story. And so, stories like Rhonda's and many of my other patients who come to us and say, we never learned any of these things, and we never had an experience like this. So what keep me coming to work every day. And so, so yeah, it really is amazing.